mucolytics. There's not much information provided in the textbook, but mucolytics mechanism of action. So there's inhaled mucolytics and there's also oral mucolytics. Inhaled, it basically breaks down pulmonary secretions. So that's the mucus part, and lytics, it's basically breakdown. It's usually used for thick, viscous mucus secretions. We also have the oral mucolytics. So one that's very known and widely used is Mucomyst or acetylcysteine. And there was a shortage of this last year. I'm not sure if they're still having shortage of mucolytics, probably related to COVID. I am not exactly sure, but I remember prescribing this medication. And a lot of the pharmacists I talked to, they're saying that they didn't have any available. So when it comes to the oral mucolytic or mucomyst or acetylcysteine, when it comes to hepatic, on the hepatic side, it prevents hepatotoxic metabolites with acetaminophen overdose. This is not used a lot for this. What I've seen it used a lot is for renal issues. So it's used as a renal protective agent, especially when we're administering contrast dye in the hospital. So this decreases free radicals in the kidneys. When it comes to the therapeutic effect of mucolytics, inhaled, again, it decreases the viscosity of pulmonary secretion, therefore facilitating coughing up those secretions. And then oral mucomyst or acetylcysteine on the hepatic side, it preserves liver function with acetaminophen overdose. So an antidote for hepatotoxic overdose of acetaminophen. It decreases the buildup of hepatotoxic metabolites in acetaminophen or Tylenol overdose, and it's most effective if given within 8 hours of overdose or ingestion of excessive acetaminophen. Renal-wise, the therapeutic effect is the preservation of kidney function, especially in the use of intravenous or IV contrast dyes. It prevents radiocontrast-induced renal dysfunction. Some indications for this medication: again, for inhaled, it's for thick pulmonary secretions, and oral mucomyst or acetylcysteine, it's for hepatic acetaminophen overdose, and on the renal side, it's for organ protection, mainly when using IV contrast or dyes. Some precautions: GI bleed or GI disease, especially with pre-existing GI ulcers or viruses when it comes to oral use, as it's absorbed in the GI tract. And some contraindication: active GI bleeding. Again, if somebody has pre-existing GI conditions, GI ulcers or viruses, then this may be contraindicated to those kind of patients. Some common side effects: nausea and vomiting. And when it comes to the nursing actions, we need to monitor for the effects, the desired effect, right? Therapeutic effects, and as well as side effects. Also, we need to ensure to clarify the reason why the patient is on this given drug. And depending on what it is, we want to make sure that it's actually used for the right route and we have the right dose, right? Because if we're using it to help with the pulmonary secretions, then it should be an inhaled form. While if it's for, let's say, hepatic or renal purposes, then it needs to be an oral form. For patient education, again, we want to educate them why they're getting this medication, the side effects and all that. But also, make sure you warn them about, especially the mucomyst or acetylcysteine, of the smell. What I can tell you is that even administering it, if you have a very sensitive sense of smell and sensitive stomach, this can make you gag a little bit. It does smell like rotten eggs. And I'm not even exaggerating. So hopefully you guys get a chance to actually administer this medication. It does have a very strong smell. Again, examples of drugs in this class would be mucomyst or acetylcysteine. This is the one that's commonly seen and commonly prescribed. And you also have pulmozyme or Dornase alpha, and I haven't really seen this ever administered in my 11 years of being a nurse.